Hi, this is Madelaine Golec, Pelvic Health Physiotherapist here at Eco Physiotherapy. Welcome back to part 3 of our pregnancy series. What we are talking about today is the core muscles in a little bit more detail than we did in the first video. So just a quick recap, the core is made up of 4 different muscles. If you look to the side right here, you'll see a nice picture that shows where all 4 of those muscles are located. But quick review. The diaphragm is located at the top here. It's a dome-shaped muscle, so when we breathe in, the diaphragm flattens out. When we breathe out, the diaphragm comes back in, up into the ribs. We have the transverse abdominis, which wraps around the belly all the way to the front. We have the multifidus muscle that sits along the spine here. And then lastly, we have a group of muscles that are called the pelvic floor muscles. So just to show you a little bit of a better view, here is the pelvis, here's the front of the pelvis, here's the back of the pelvis, and as you can see inside, all that red are the pelvic floor muscles. Alright, so what do these muscles actually do? So the transverse abdominis and the multifidus muscle, what they do is they provide support to your spine and to your pelvis before you do a movement. So before I move my arm, before I move a leg, or before I stand up, these muscles activate to provide a little extra stability. The pelvic floor also does that, but it also supports the bladder, the uterus, and the rectum, which are the organs that sit inside the pelvic bowl. The diaphragm's job is a little bit different in the sense that it helps to relax and tension the transverse abdominis and the pelvic floor. So what I sort of mean by that is diaphragm is here, pelvic floor is here. As I breathe in, the diaphragm flattens, the pelvic floor relaxes. When I breathe out, the diaphragm comes up, and the pelvic floor recoils back into the pelvis. This is important because when we're talking about core function and coordination, all 4 of these muscles must work together, kind of like gears inside of a watch. If one of the gears is stronger than the other or working better than the other, the watch is not going to work quite as good as it can. And we can experience some of these problems during pregnancy, as the transverse abdominis could become more stretched depending how big you really get. The pelvic floor can get a little more stressed because of the extra weight, the extra downward pressure, and then of course the gears are not going to work quite as coordinated. So this can also happen post-pregnancy when you're trying to get back into shape, you're working your core, but if you're not working all 4 muscles together, you're missing a gear in that watch, and if you're not coordinating your movements with your core exercise, then of course your different gears might be working at different speeds. So you definitely want to make sure that you come in and see a trained physiotherapist. Also a good idea to see one that is trained in the pelvic floor, because if you're working the core without the pelvic floor, you're missing one of the important muscles. So come in, see us, let us help you get connected with your core, let us help you decrease any pain or incontinence you might be experiencing during pregnancy, let us help you decrease the likelihood that you're going to become frustrated because you're not seeing the results that you want to be seeing, and of course training the core will also reduce the risk of injury during exercise. So for our technique today, what I want to show is how to do deep breathing. Surprisingly, even though we need to breathe to survive, a lot of us underutilize our diaphragm. So we're going to use a visualization of a balloon. So I want you to imagine you got a balloon in your abdomen, and when you breathe in, this balloon expands. When you breathe out, this balloon recoils. Since most of us like to breathe up in our chest, we're going to actually place a hand there. We're also going to place a hand on our abdomen just to help give us a cue and help us out with the visualization. Now when you breathe in, you want to make sure you breathe in through your nose and breathe out through your mouth. So what I'm going to do is I'm going to turn toward my side so you can see the movement of my abdomen a little bit better since I'm a little bit bigger. and let's get to it. Alright, so what we're going to do is we're going to place one hand on the top and one hand on the bottom. When you breathe in, I want you to visualize that we're blowing up that balloon, and we're using this hand here to make sure that we don't move our upper chest. So it's going to look something like this. So taking a deep breath in, and then breathing out. Alternatively, if you find that a little difficult, what you can do is you can actually bulge the abdomen a little bit, and then imagine drawing the air into the bulge. So it'll look kind of like this. So you're going to push your belly out, and then you're just going to breathe down into the belly. And then out. So the big key is you're trying to not let your upper part move. All the air is coming down into the belly and flattening out that diaphragm. Hopefully you found that technique useful. There are other techniques on retraining deep breathing in the core, but for that you got to come in and see your local physiotherapist, and we look forward to seeing you on the next video. Thank you.